Hello, Charles County. Welcome back to our second episode in this year's Gift of Information series. We share this series every year to try to give a little bit of an extra gift to our residents around the winter holiday season and New Year, where we find ways to get you some information that helps you live your best life in Charles County. This episode is all about resources and services available to the humans of all ages who live in Charles County. We're calling it Utilizing Resources and Services from the Cradle to the Grave. Thanks so much for joining us today. I'm Doria Fleisher with the Media Services Division. I am joined by Laura Gustafson, who is our Deputy Director of the Community Services Department.
Yes.
Thanks for being here, Laura.
Thank you for having me.
So, Laura, we're here to talk about resources, which is kind of your, I feel like, middle name, including, I just want to give a special shout out that you are the kind of person that at 5 p.m. on a Friday before a holiday weekend, when something comes up and I can't figure out how to resolve it, you're the person that I call and you always pick up the phone. So thank you. Does it get exhausting at times to be the resource person that everybody wants to check in with?
It does, but I also enjoy the challenge because there truly are never two situations that are the same. And I think for me, to continue enjoying my position and the work that I do, having those changing needs is what keeps me interested in the work.
And I think that's going to be one of the hardest things about today's conversation is I'm asking you, and in prepping for this conversation, I know we talked about it, like I'm asking you these big picture questions about what services and resources are available. And you keep going, but not this one, but only for this person, but only for that. So I apologize. I know I'm putting you on the spot where I'm asking you kind of big picture and instead of specifics. One of the things I appreciate about your department, though, is that I know that if somebody has a question about whether they qualify for one of these, they can call your department and they'll get help in walking through the intricacies. Is that accurate?
That is accurate. And I think that's one of the things that we have intentionally woven into how our department operates is that first and foremost, if you call us, we try our best. If it's not a service that we offer, we don't just say that's not us and send you on your way. We try our best to find where that service is as long as it is available, you know, who to do a warm handoff with.
Yeah.
And the second thing is to empower our community to know that we don't necessarily need you to know all the details of eligibility and things to refer a friend, a family member, or a neighbor. We want you to know just enough to get them to the right place and then let us take up from there.
That's beautiful. So that's a great lead in. Talk to me first, Laura, about the Department of Community Services, what that means, and then I'm going to ask you about your specific role in that. But what is that department in Charles County government? What do you guys do?
So the Department of Community Services, we have on any given day between 60 and 70 employees comprised of both full-time and part-time. And we have three primary what we call divisions. Those are subsets of the department, and that is the Aging Division, our Housing Authority, our Housing Division, and then within admin, we have the Local Management Board. It actually holds two names. It's the Local Management Board and the Charles County Advocacy Council for Children, Youth, and Families.
It's such a mouthful.
It is. It's a lot, and the advocacy word doesn't always accurately describe what it does, but of course, aging is for our community members who are 60 and older. Housing Authority has programs that help people with their housing needs, and then the Local Management Board or Charles County Advocacy Council for Children, Youth, and Families does programming for our youth and our families in our community.
Perfect. So we're going to break down each of those, less about kind of the specifics of what they do and more about the services that people can find in them. But before we do that, you have a very interesting role in that you're the deputy director of the department, so you oversee all the things, along with your director, Dina Barclay. But there's also a resource component that got added to your role when your role was created, yes?
Yes.
Okay. Talk to us about what your role looks like and how that resource component exists.
So for several years, I think there was a hope that there could be more coordination amongst some of the community partners and how we do bring resources to the community and how we work with each other. So I like to say we're using resource coordination on one of the terms that we sometimes use is macro. So it's on a bigger picture level. It's not necessarily for an individual, but it's how we as a system work with each other and how we're being intentional about not overlapping and all going after the same thing and being good strategic partners, and also often working together to pull off something large. Like recently we did a resource Day event, and that was in October, and we did it collaboratively with other key partners such as the Health Department, Public Library, Department of Social Services, Charles County Public Schools. There were many more partners, but those are a few that people may recognize. So I think that's an important aspect of trying to maximize our bandwidth amongst all of us by leaning into each other when it makes sense.
So we have so many agencies, organizations, nonprofits, divisions that do work for the humans in Charles County. And when we say say case management for that, it's, a case manager helping that individual or helping that family navigate the systems. Yeah. But your role is really much more kind of helping the agencies, the organizations navigate the system so they can then trickle it down to those individual households. Is that accurate?
Yes.
Yeah.
Yes. And helping
it's
us
a lot.
It is, and helping us all, look at the angles of which pieces of our community and what strategic needs we are trying to meet. Because again, there is a lot to be done, and it's not helping any of us if we are either all chasing the same thing or not helping gap fill what each other's already doing.
Right.
And sometimes we're so busy in the work that communication with each other just doesn't happen because it's a bit of an afterthought. But a lot more can happen when we're leaning and working on each other.
Well, I'm thrilled that your position, you've been in this role for how long now?
Not quite 2 years.
Not quite 2 years. Okay, gotcha. And so I'm glad that we're seeing that if kind of the 360 view helps our agencies, our departments, our divisions, our organizations work together, then that just means stronger services for our community members.
Yes, that's the goal. And I think there's, always more and growth to be done. So
of course.
Certainly not saying that there isn't more to reach, and I think I always have an ongoing list of one day I'd like to see this and one day I'd like to see that, but progress is still progress.
Well, I'm glad we're making progress, and I appreciate that we've got you at the helm to kind of keep us moving in that direction, because I know it's hard to be a human. It's hard to be a human in 2025. There's a lot going on at the federal level, and I think it's hard to be a human sometimes in Charles County, which in some ways still feels like a rural, kind of less urban. We have less, we always hear you're not Prince George's County, you don't have the services of DC. But on the other hand, we're not teeny. Mm-hmm. We are growing, we're progressive. So it's an interesting balance to be a human here. And I'm glad that our residents have some help. So let's talk about what that help can be. And I love that when Department of Community Services comes to Citizens Academy to present, you guys talk about from the cradle to the grave. So from our very, very youngest, newest residents to our elderly residents who are going to pass away after a lifetime in Charles County, you have services at every level.
Yeah.
So can we kind of start just kind of going in that direction of if one of our listeners, viewers to this has young folk at home, from itty bitty babies to kids, teenagers, adolescents, what kind of services do you wish people knew about that they could take advantage of?
So most of those services would be housed within our local management board that I referenced earlier, and they have programming that starts as early as prenatal care, so before the child is even born, and then they have services that run all the way through adulthood for children and families, because we definitely recognize the fact that while we may be serving a child as our primary point of contact, that whole family then becomes who we're serving, because the child is better and stable and happier when their family is as well. So the focus is on the child, but it really is the whole family that we're working with.
Gotcha.
And within the local management board, we have several programs ongoing that are funded through our grant funds that come primarily from the Governor's Office of Children and Maryland State Department of Education. One of the programs that I think would be most beneficial would be our local care team, because they convene multiple external agencies. Again, this resource coordination that we're talking about, they convene those agencies together to try to put together an action plan of services to connect with the child and the family. So
the local care team is run through you. The Department of Community Services gets money from the state of Maryland and says to you, figure out how to best spend it in Charles County. And one of the, am I correct, it's a requirement that a local care team exists. Yes, that state of Maryland says, we're not going to tell you how to do it, but you better have a group of people that sits around a table.
Correct. And I would actually say if anybody is watching or listening to this and they happen not to reside in Charles County, there is a local care team in every jurisdiction in Maryland. So if you're hearing this and you're interested but happen not to be in Charles County, you can find one in every jurisdiction. And the model...
Ours is obviously the best.
Absolutely.
Absolutely. Okay. But the model is...
The model is across the state in all the jurisdictions.
So without going too deep into the weeds, what is a local... Like if I had a child that needed supports, what could the local care team... Who do they work with, and how does it work?
Typically, there's about 8 to 10 different service partners that sit on the local care team. They meet with the adults in the home, and they discuss what concerns they might be seeing with the child. And we really do encourage people. I think sometimes it gets misunderstood that things need to be at a certain level of severity. We would much rather you come to us sooner rather than later. So there is no criteria or minimum for the challenges that you and your child may be experiencing. But generally, we see things that involve mental health or other behavioral concerns, a vast majority of our referrals do come from the school system. But when we meet with the adults in the household to assess what their concerns are, we typically do not involve the child in the discussion, because if they're the center point of the concerns, we don't want the child to feel like they're being talked about. So most often the child is not in that conversation.
So this is not therapy for the child.
No.
This is finding resources that the adults around that child can utilize.
Correct. And one of them may be therapy. We often do refer to agencies that can provide therapy for the child. And at the end of this conversation, usually within about a week or so, the family receives an action plan, and it has direct points of contact, any referrals that are needed to enroll the child in these services. And on the front end, when we're doing the intake for a local care team meeting, we get the insurance information, any known diagnoses, and all those things to really help our team make a more intentional list of referrals for the child and the family.
I mean, it sounds so wonderful of this idea that the experts in the room, the Charles County experts in the room, are sitting together and hearing what a family's concerns are, and then everybody's coming in with their own, like, well, we could offer this, the health department could do that, the school system could do this, what do you qualify for? It's kind of what I think I wish my healthcare looked like. Do you know what I mean? Like, I wish my team would sit
all
around the
these different
table
angles.
and
Yeah, and I also like, typically on most meetings, unless of course they're not there for some reason, we have Maryland Coalition of Families has someone on to do what we call peer support or lived experience, and that is a parent who has walked through their own experiences with their child needing different services. So that often can be very powerful just for them to immediately have a peer and somebody who understands, because you have a group of professionals and we're all there to help, but I think the feeling of people understanding your journey and what angle we're coming from feels different with a peer support person. So that's why we intentionally have them a part of the local care team meetings, is for the family and the adult support.
Awesome. So I will make sure that all the details get added so people can find this resource. But you said most of the referrals for the local care team come from the school system. But if a family member, a coach, anybody could refer a child to the local care team, yes?
Yes, anyone can refer, absolutely. And again, we would rather you refer sooner than later. If for some reason we don't think it's a good fit, we'll work with you offline and still maybe make some connections to resources. We do require, though, we will not have a local care team meeting if the parent or guardian does not sign the consents, because we're discussing minors.
Right.
And also because in a practical sense, if the parent or guardian involved with the child isn't at the table, then the next steps of engaging those resources probably isn't going to be that successful.
No,
so
I
that
think
is
that
a
makes
requirement.
sense. Gotcha. Okay, so I think that's a great program to touch on. And then in general, when we talk about the local management board, the other programs are really what you all are funding, not necessarily what you all are implementing yourselves. Is that an accurate statement?
Yes. So there are what we call strategic goals. Sometimes they're called pillars that are set through the governor's office of target areas that we can use the funding to meet. But then we also do a triannual needs assessment within Charles County to identify gaps in areas that additional services are needed, because our goal is not to replicate other services we have. Our goal is to maximize these funds by filling gaps.
And I really appreciate that I think sometimes it feels like all the work sits on government's shoulders. And this is really, it's not sitting on government's shoulders. It's sitting on government's shoulders to figure out who's doing the best work and get them the funding and the resources available that they need for our kids. Yeah?
Correct. Our local management board has 3 staff. So when I talk about the amount of programs that we're pushing out and the number of families within Charles County who have utilized our services, we could not do that without the work that we get through our sub-vendors and our contracts to actually have the programming happening.
So making sure that the people out there doing the work have what they need.
Yes.
That's great. So in general, for our youth, we've got the local care team where you can go specifically for like that intense support around a family, but then a bunch of other services, organizations supporting, and people can either call or navigate the website and
Yes.
find out. Okay.
Yes.
So moving along the lifetime timeline, housing, which is such a tough subject. And I know I'm so grateful. You've been doing such great work communicating that with us. We just did our big homelessness push and understanding what homelessness is, the language behind it. But talk to us about housing on kind of the bigger picture community services level and what kind of resources and services are available for a variety of people with housing needs. Yeah?
Sure. So our housing division administers our housing choice voucher program, which for the community is often recognized by the term Section 8 as well, but we don't we call it the Housing Choice Voucher Program. And then there's also community development programs, and we have things there like our special loan program and other areas of assistance that can help people who are actual homeowners, or sometimes we even have home buying assistance. Again, all these programs come with certain qualifications.
So
and
many
income.
stipulations,
Yeah.
right? And you and I have talked so much about how frustrating that can be for our residents, as in like, you told me that this program exists and now you're telling me I don't qualify, or my cousin qualified and I don't. But also how frustrating it is for our staff to have to track it. This is not done just for fun, right? This is not done of just like, let's make difficult criteria. This is because of the funding availability.
All of our criteria typically is dictated by our funders, and then also the amount of funds that we have to work with are dictated by our funders. Oftentimes our grant funds come with what they call an allocation, so they do kind of a percentage and they decide how much your area is allotted from the bigger pot. So we have what we have, and I am not immune to the fact that it really creates a lot of still need in the community, and we have wait lists and people who they need something tomorrow and our lists are full, or we're maximizing the dollars that we have to serve and I can't help them immediately. So I think that's one of the struggles when we do see it, because we are real people who have a passion for helping others, and sometimes our hands are just tied with what we currently have to work with.
Yeah, and some of that comes from the federal level, like federal regulations, state regulations trickles down to us. So it's great that we have the money, but we can't just use the money how necessarily we see as best. It comes with,
and sometimes even with income eligibilities, we'll work with people who are just barely above it. So they're just enough above it that it doesn't mean that their life is any easier or that they don't need the assistance.
Right.
But yet
they just don't qualify.
And the line are there and we can't break them, and those are really hard.
Yeah. So I know that when you guys talk to Citizens Academy and our other programs, when you come out and you talk to the public about housing, it's such like we could spend hours just talking about it. To me, I think what I would want our residents to understand, but tell me if you agree with this is how I always say it. There are supports out there if you are struggling with housing, whether you're struggling to pay rent, whether you're experiencing homelessness, whether you are a homeowner who has major repairs that you need. There are some services available.
Yes.
Contact the Department of Community Services if you are struggling with your housing, and they will help navigate where you could be served. Is that a fair statement?
It is. It is. But again, I always caveat it with, I can't promise you that when you call, I'll have something immediately available. And that is what's hard. Is the need exceeding what we have to offer.
Right.
But I do think we try to do our best to navigate you elsewhere if we don't currently have it.
And that's where that resource connection from your position comes in so handy, is that you, am I correct, you're pretty familiar with what Department of Social Services, what the health department, what the school system, what our nonprofits, you can kind of identify where the gap could be filled for that person.
Yes, I've worked with those partners for several years through my previous position, so I think that is what equipped me to be able to think, independently on how to piece together some other alternatives for someone if I try to. Again, I don't always successfully have exactly what they need. I also think housing specifically is a national challenge. So unfortunately, we're focused on what we can do locally, but when you look nationally, it is a really big thing to undertake, and I think if it was simpler, it would have been done by now, right? So
it would have been done somewhere that's bigger population than Charles County, more resources.
So acknowledging the challenge doesn't necessarily mean you know how to fix it.
Right. Well, and I would encourage our viewers and listeners today, if you haven't listened to our roundtable response, the collaborative response to homelessness, please tune in. It does not have magical answers, but I think you hear that from our partners. It's a complicated topic, very complicated.
And I think as residents of our community weigh in and use their voices, especially now that we have things like our budget survey and other ways for you to say how you want your resources allocated, I think starting to make sure that we know the factual information of where things stand currently is the best place for anybody to start if they feel called to do any sort of advocating.
Gotcha. Good. Starting with that data, which I know your department does. A lot of data.
Yes, we like data.
All right. So we've talked about big picture, what's available for youth. We've talked about big picture if you're struggling with different aspects of your housing. This could potentially help. I think this one has a soft spot in everybody's hearts, is talking about our older residents in Charles County, our seniors.
Yes.
What are some of the resources and services that your department is most, I guess, dedicated to, proud of, or even struggling with? Like, we know there's not enough.
Yeah, so aging is actually our largest division. And to your point, aging has a soft spot for me because that's where I started with community services. And I think our seniors are just a very special population. They've put in a lot of time and years and investment into our community.
Yeah.
And now they're at a point where they're looking for the community to return the love in some aspects.
Yeah.
So again, our aging division being the largest one that we have our senior centers. There's 4 of those. They operate Monday through Friday. We do meals at the senior centers. There's a lot of good programming. We have programs that are tailored towards trying to help them stay physically active and healthy because we know that that can help with your longevity.
Yeah.
We do a lot of focusing on dementia awareness and any dementia prevention that we can educate on. A lot of caregiver support because as you and your loved ones, whether it's your spouses, your siblings, your peers, it could be your lifelong best friend.
Right.
You're aging with people that you care about, and sometimes, again, with the resource component, they may have care needs that the resources aren't there to meet. So how do you navigate that?
So, we raise our children in a world where the school system's there from, up to age 21. Like, we're going to make sure we've got you. But we raise our seniors too, and we have to take care of our seniors. And I think those resources can often feel grayer of like, what do I do when my mother, father, guardian, partner starts showing signs that they need more care than I was ever trained to give. Yeah.
Yeah. Well, and I think too, over time, society looks different than it used to. So having, a 2-adult household where one of them maybe worked in the home or, took care of the home as their primary responsibility, things aren't as common to be that way anymore. So then the caregiving needs become more and more problematic. We also have adults that are in the workforce longer. So then, as we are still in the workforce as older adults and our parents or other older loved ones need care, we're not able to provide it because we're still
working.
At work. Yeah. So I just think
it's different.
Our society dynamic has changed in that way. And that stuff isn't bad, but it has created a challenge when it comes to providing care.
We can't do things the way we always did them.
Yes.
Yeah. So if a senior, if an older person, 60 and older, is looking for something to do physically, mentally, socially, senior centers are a great place to go. And meals are a component of that, yes?
Yes,
okay, so
they
talk
are.
to me about the food part because I love this component.
So meals are a component. We offer meals daily at our senior centers, and the meals are actually constructed intentionally to be a balance of certain components to make sure that we are providing healthy, nutritious, balanced meals as well. We have it used to be Meals on Wheels. Now it's home delivered meals, but people normally when they hear the term Meals on Wheels, they kind of know what
it means.
About.
Yeah.
That delivers meals throughout the community as well for our homebound seniors who are unable to leave their homes. And then recently we also just did a large amount of food distributions in what we called meal kits, and it was bags of different things that included fresh produce because we're always trying to be mindful of what we're giving to our seniors is something that's going to promote their health and their wellness and not necessarily something that, might be shelf stable or a completely frozen, microwave dinner.
I think it's also a nice kind of it feels more special. It feels like a grocery delivery, not just here's this, eat it when you want it. Yeah, it feels like somebody actually shopped for you.
It does. And then we have our Maryland Access Point too, and that has a number that they can call with our Maryland Access Point. And again, there is a Maryland Access Point throughout all jurisdictions.
And that's kind of tell me if I'm saying this correctly, like the hotline for I am somebody older who's looking for services, or I am somebody who's looking for services for someone older. Where do I go? What do I do?
Yes. And then we also have staff through Maryland Access Point that work with them that are information and assistance staff. So again, I think more importantly than necessarily everybody understanding all the intricacies, if you call and it's not us, we'll do our best to get you to the right place.
I think that's kind of a theme of everything we've talked about today is that, I don't know, I go back and forth sometimes, Laura. Sometimes I think, oh my gosh, why does Charles County not have more? Like, how are we missing these things that you hear about other jurisdictions having, or you don't hear about jurisdictions having, but it's like, we have to take care of our people. Why don't we have that? But then there's also so many times where I either hear from residents or I see online and social media chatter, I can't believe Charles County isn't doing anything about this, or I can't believe we don't have those services. And when I'm looking, we do have those services. It's just that people aren't aware of them or don't know how to access them. So I am hoping that this provides, every time that you're out talking, every time that you're out connecting, it's the idea of let's identify what we do have that's getting underutilized, and let's identify what we don't have so we can fill those gaps, like you said.
Well, and I think that's one of the reasons why I love Citizens Academy, because clearly I am one person, and even, with our department, when you think about the size of our community, our department is not a very large department.
It's not balancing out.
Especially we have many more part-time staff than full-time.
Yeah.
So, they're doing the best that they can to get the information out. That's also one of the reasons why we came up with our Charles County Resource Connection website, is because through several years of my history with the local management board and being involved and hearing directly from the community when we would do focus groups about what their needs were, when they would list needs and gaps that we did actually have, it really seemed like, yes, there's a need for more, and I would never argue that.
Right.
But in the meantime, let's make sure that people know what we have and people can utilize it and reach it to its maximum capacity.
Yeah.
So that is really where the idea of the resource website came about, and we're currently at about 100 listings, and certainly
amazing.
hoping to grow more. It's still a very young website, so I hope people will use it, and also that the professionals and the organizations in our community will make sure that they are on it, because it's only as good as the listings that are on it.
And I know you've done a lot of work on that, of making sure that the partners know to use this website also. So I'll make sure that all of that information is available in the show notes so people can find it. But this Resource Connection website was designed as just a one-stop shop, right? You type in, I'm looking for housing, and it says these are the partners that are providing something to do with housing in this area, yeah?
Yes, and I mean, again, you talk earlier about I have kind of some short-term goals that we can do in quick time, and this is definitely more of a long-range project, but I would love in the future to see that it's got hundreds of resources. It was intentionally designed. We contracted out through a web developer, and it was designed to be searchable because we did not want people to have to comb through a listing like a phone book. And we also didn't want you to have to use the right terminology for it to take you there. So on the back end, we worked with them to create keywords. So you don't necessarily have to put clinical services. You could put therapy. There's a way that you can word it, because we didn't want it to be so specific that it was meant only for professionals who might use certain jargon or terminology. We really wanted it to be for the community at large to use
it. Yeah, I think it's again, being a human can just be hard. And the more we can provide supports for our humans it is going to be tough to raise a family. It is going to be tough to figure out how you're going to pay your bills at a time when our economy is tight. Yes. It is going to be hard if you're working longer and also taking care of an older loved one. So I appreciate that as much as we can do to offer those resources is huge.
I also think for our community, if you are someone who doesn't necessarily find yourself in need of assistance, but you are feeling a pull to help your community, and you have a certain area of help that you want to provide, or a certain type of service that you wish you could volunteer with, you can use the website for that. You can go and see what kind of providers we have in a given area. Like just if you want to help with domestic violence, or you want to help with something to do with children, use the website and use it to get involved in your community. There's so many other ways that I think having all this information in one place can just be beneficial.
That's awesome. Well, I'm really thrilled that the website exists, and look forward to it just continuing to grow and develop as a great resource in our community. So, Laura, you've mentioned a couple of different things. You've said, call our office. We talked about calling Maryland Access Point. We've talked about being involved in the budget process. So, if you're somebody who's consistently saying, why isn't Charles County doing more? Learn about how much funding is going into that and where you think more funding should go. What else do you want our listeners and our viewers to do, to remember, to think about? And also, I think this is a huge one, to share after listening and watching this episode. Like, what are the takeaways you hope people will grab?
The top share for me would absolutely be the website.
Okay.
And I know I kind of already said a little bit of that, but it is only as good as what's on there. And also, your neighbors and friends and family can't use it if they don't know about it. And because it's so new, it's definitely in its early marketing phase.
Right.
So while we recognize there's more resources to be added, right now we're getting about 1,000 visits to the website per month. When I checked the data earlier.
That's great.
That is great, but I'd love to see it higher.
We have 177,000 people in Charles County.
Correct.
So.
Yes. So, I mean, that would be, if I had to pick a top share, that's definitely it. I think our second one is to understand that when we have the very hard decision of telling somebody either they are ineligible for a service or we can't offer it because it's waitlisted, even though they are eligible, that those are not decisions that we are personally making. Those are tied to budgets and criteria that are set from funders. And because the vast majority of all of our programs at Community Services are grant funded, grants naturally come with prescribed areas that they want you to use the funding. So they're not
Right.
necessarily as flexible, again, as those people who maybe fall just above that criteria
Right.
and are still standing in front of you very much in
Needing
need.
help, yeah. It's interesting because it's almost like a two-part ask. It's, part one, please don't make assumptions about what you're eligible for or what you're not eligible for, just call.
Yes.
And then part two, you might not be eligible, and please understand that as we try to work with you and find what you are eligible for, these are not magical answers, and I would assume that the saying no is a really tough part of your job.
It is. And I think also, if it wasn't already clear today, hearing us acknowledge as people who do human services and who got into this work because we care about people and we want to make a difference, that while we are saying we do have things, that doesn't take away from the fact that we're acknowledging there are still bigger needs and that there is not currently enough. And I think both can coexist. So it's hard sometimes when we are talking about what we offer that it doesn't come across as if we're saying that
Everything's
everything,
great. We have everything you need right here in
Right.
Charles County.
Right.
I appreciate we might not have everything you need, but we're going to try really hard to work with you to get you what we can
Right.
and identify where there's something missing. And thank you to the Department of Community Services for understanding that and then continuously seeking the new grants, the more money, the new programs, the flexibility.
Yeah.
It means a lot. I feel really lucky that we have the Department of Community Services in our county, so thank you.
Well, thank you. And I also think the aspect that sometimes people don't see is there's a lot of work that goes into grants because they all come with their own reporting, their own timelines, their own management. I don't think we have any grants that don't have performance measures that we have to track, which is good. You need to know where the money's going and what it's doing.
But that takes work.
It all takes work. So
Yeah.
it's not just that getting the money is even the instant answer. Having the bandwidth to accept the money and manage the money, there's a lot that goes into it.
Yeah.
So, it's not always as easy of a fix as it appears, which again, I think if it was, we would have done it.
Right. It's a lot to unpack, and I just appreciate the work you're doing. We will keep sharing that Resource Connection website. I also am going to put you on the spot, Laura, because before this episode, you said, I know that this is high-level stuff. When can we talk, in the weeds? So if you have enjoyed this conversation with Laura Gustafson and you're thinking, but what else? Don't worry. Laura has committed to coming back with her team to make sure that we share even more information about what Department of Community Services and our affiliate partners and our agencies and organizations are doing in the county. So Laura Gustafson, our Deputy Director of the Department of Community Services, thank you so much for being here today.
Thank you for having me.
And thank you for the work you do in the county. It does not go unrecognized by your peers. So
Thank you.
much appreciated. Also, a big thank you to you, our listeners and viewers, for tuning in today to today's episode of Gift of Information, talking about resources and services available to residents in Charles County from the cradle to the grave. We hope that if you missed the first episode where we talked about 12 budget hacks to get you through the year and save a little money as a Charles County resident, that went out last week. Make sure you go back and listen to it. Coming up next week, we're going to be talking about how to live your best life in Charles County, places to go, things to do, and how to be kind of a tourist in our own backyard. I really appreciate you tuning in and look forward to more episodes sharing information with you. I'm Doria Fleisher in the Media Services Division. Take care, stay safe, and stay engaged.
Thanks for listening. If you like this podcast and want to hear more, search Charles County Government on Apple Podcasts, Spotify, or wherever you get your podcast. And be sure to like and subscribe. We're also available on YouTube. Search Charles County Commissioners. And stay connected for all county news, information, and programs by visiting www.charlescountymd.gov/stay connected.